Hi, how are you today? I'm Katie Holland. I'm so excited to be back here on the Power Stage. This is a fantastic crowd to talk about women's health, which we know is an extremely important issue in gender equality.
Hi, I'm Trey Watkins. Katie and I are just so proud to be part of Praava Health Advisory Board, and we're thrilled to introduce you today to Sylvana Sinha, founder and CEO, who unfortunately couldn't be here with us.
That's right. Unfortunately, Sylvana was not able to be here, but she was just so thrilled to be included in the Power Stage that she made a fantastic video. We wanted to be here to kind of amp the crowd a little bit to get us ready for this really great video, and those watching online. So I hope you'll enjoy the video from Sylvana Sinha and Praava Health.
You walk into a clinic. Crowds are waiting on the dirty seats and on the floor. You drag your suitcase of medical records and wait for hours while more people stream in. You finally get to see the doctor and get to spend maybe a minute, maybe less with him. You're sent to another location to have your blood work run. You can't be sure that the results are accurate, so you go to 3 more labs just to compare. You continue to brave traffic to pick up your prescription at a pharmacy. Maybe the drugs are real, or maybe they're not. If you've ever been a Bangladeshi patient, this may sound like your last visit, or maybe every visit. As a Bangladeshi American, I knew the healthcare system of my family's native country was limited, but my eyes were open to the challenges facing Bangladesh's 170 million people when, a few years ago, my mother was hospitalized for a basic operation. She suffered some complications, and unfortunately, our doctor didn't seem to care what she or our family were going through. I distinctly remember chasing him up 2 flights of stairs to get answers to our basic questions. Thankfully, my mother recovered, but the experience haunted me. The next thing I knew, I was packing up my life and going on a global listening tour to learn more about the Bangladeshi healthcare system that had failed my family. Bangladesh is actually doing better on social development indicators than any other country in South Asia. By investing in primary care, the public system has made dramatic strides in terms of life expectancy, maternal and newborn health. But beyond the most basic primary care, even the masses are accessing the private system. The private system, in contrast, unfortunately, undervalues primary care and delivers episodic care that's highly transactional and driven by backwards incentives, encouraging doctors toward hospitalizations and over-ordering of tests and drugs, treating patients like dollar signs. This is not a system that patients can trust with their lives. In fact, thousands of Bangladeshis travel every single day abroad to access better care. I met a maid who earns $3 a day, and when her daughter fell ill, she borrowed money not to access the best doctors in Bangladesh, but to travel to India, where she believed she would be able to get better care for her daughter. Across the board, Bangladeshi patients told me their doctors don't spend any time with them, they don't answer their questions, they don't even look at them in the eye. A light bulb went off for me, and I launched Praava Health. You walk into the lobby. You're greeted by a Praava guide. You scan your membership card, which gives you access to services at an affordable price point. You meet your family doctor. She spends 15 minutes with you. She listens to you and answers your questions. She's not in a hurry because her success is measured by her patient's health, not volume. Maybe you're pregnant and need an ultrasound. You're escorted to the 5th floor for that. If you need blood work done, you go to level 2. From there, your sample is sent directly to level 7, where it's analyzed in one of our 6 labs. You don't have to wonder if you can trust the results because our labs are established according to international standards. On your way out, you pick up your prescription in our model pharmacy, where you can trust that the drugs are manufactured, stored, and dispensed properly. Praava is changing the way that healthcare is delivered in Bangladesh and filling an important gap between underfunded public facilities and overpriced private facilities. On top of this, we're rethinking the way that technology can transform a doctor's visit. We host Bangladesh's first patient portal, where patients can access their medical records and prescriptions and book appointments. And if a patient brings a bag of their medical records from life before Praava, we scan and store it for her. Praava's brick-and-click model promotes a continuity of care so that no one falls through the cracks. As Bangladesh grows, and remains one of the fastest growing economies in the world, the private sector cannot afford to continue business as usual. We need a healthcare system that's accountable and transparent, driven by values. Across the globe, we all need healthcare systems that treat patients with dignity. As a female CEO in a sector where female leadership is so lacking, I take my role very seriously. Our voices are needed when the burden of caregiving falls so disproportionately on us. Every day when I walk in, I think about chasing my mother's doctor up those stairs and about that maid who stretched herself so thin to get better healthcare for her daughter. This is my guiding light, to restore trust in a healthcare system that's broken and to reimagine the way that healthcare is delivered.
I'd like to call Catherine and Trey back up to speak a little bit about, and we've seen a lot of women speak about their leadership roles in healthcare, but one question that I'd love to ask is, how common is it to have a female CEO of a hospital in Bangladesh?
It's not very common, not in Bangladesh and really not anywhere. We've had several founders and CEOs on this stage today who we've heard, including our first speaker, say she's looking forward to the day where she can just be an innovator and a founder and not have to also flag the obvious that she's a woman. And so Sylvana is absolutely a leader, but part of what she advocates for is that we need more women founding and leading in health. One of the things that's really exciting about Praava is that Sylvana has put together an entirely, well, almost entirely female leadership team across all different parts of Praava's operations. She's got a fantastic team with a lot of very excellent men as well, but it's really wonderful when you go to that website, praavahealth.com, what you see is that extremely strong and diverse team that does include a lot of excellent women.
Yeah, no, absolutely. I would say I think it speaks really to the power of vision. You just heard about Sylvana's guiding light and her vision, and it speaks to the power of really raising your voice and breaking those barriers to improve health outcomes for some of the most marginalized in the world.
And I think we've also seen a lot of different innovations, and I really wish the CEO really well, and it's really great work that you guys are doing. So thank you for joining us. I really appreciate it.
Thank you. I mean, you use the word innovation, so I just want to make a comment there. It's a really fantastic combination. We heard yesterday in the activism session, Jacqueline Novogratz was talking about the concept of dignity and the importance of dignity in this work. When you put together dignity with innovation, it's a really amazing combination that you get. And one of the things that Praava is really bringing to the table is innovation that is really not seen before in the health sector in Bangladesh. They're offering the first digital health information systems. You heard her say in the video, people come into Praava with a bag full of scraps of paper that are their health records from their life. They're scanned, they're cataloged. She also mentioned in the video, the lab at Praava is up to international standards. I'm sure many of you are aware that right now there's only one internationally accredited lab in Bangladesh for now, because I think I know where the next one might be. So anyway, we just really, Trey and I have been so honored to be with Sylvana, to be as part of this advisory group. It's a fantastic global team behind Sylvana in the lead. And I would just really encourage everyone to, if you have more questions, we don't want to speak for Sylvana. We learned a long time ago you don't try to speak for Sylvana. So we really encourage everyone here to reach out to her. I know she would be absolutely delighted to hear from you.
Great. And what was that website again?
PraavaHealth.com.
All right, perfect. So are you writing it down and tweeting about it? Because that's what we need, so you don't forget it.
I would just say, I mean, just adding on what Katie has said, I think when we think about this in the broader context, right, we have all of these conversations around universal health coverage and primary health care, and we see this model coming out of Bangladesh, right? And it's revolutionizing the way healthcare is delivered in resource-limited settings. And so I think when you think about this sort of model in that context, it's so powerful.
Of course, integrating healthcare, and as we saw, we don't see that even in the global north. So it's really great to see something that the global north can learn from the global south.
Yeah, we've got an example of power, progress, and change right here.
That's wonderful.
Thank you so much.
Thank you. Thanks.